again, maybe asking a family member to come with the patient. So again, this takes planning. So your office staff has to go through the patient roster, recognize which patients may need a translator. I think some EMR systems do have that within their profile, whether the patient needs an interpreter, maybe calling the patient and asking them to bring somebody. Because even if you have an interpreter, again, maybe having a trusted family member or friend in the room with the patient that can listen to what the physician is saying, translate with the help of an interpreter, but also, make sure the patient follows up and asks any other questions. And sometimes the family member can also relate to the physician really what the patient is thinking, because sometimes the patients may not express all their beliefs or hesitancies or fears with the physician alone. So I do feel like a family member is important, making sure the interpreter services are available before the patient comes in. And I would say, again, just I can't tell you how many patients have thanked me for giving them information in their own language. Again, because even if I give it to them in English, they still may have the same hesitancy or questions. But I feel like, again, when they're reading it in their own language, it's easier to digest. And again, they recognize that the physician really wants to help them, and then they're more likely to listen and speak with the physician and then come back. So again, the other thing is getting the patients to come back, because it is, again, a very daunting topic. It's a very daunting disease. It can get complex, and sometimes patients just sometimes feel overwhelmed and they don't come back for months or years, honestly. So again, making sure the patient comes back for a follow-up visit and scheduling the visit right away, like within weeks, 2 or 3 weeks, and not months as well, is really important.